It's my pleasure to welcome you to this webinar on monitoring human rights indicators. How can this help to accelerate SDG6? My name is Raya Marina Stefan. I'm an international water law expert, and I'm the Deputy Editor-in-Chief of Water International, the journal of the International Water Resources Association. This webinar is about, like I said, the human rights indicators. The development of human rights indicators plays a key role in the human rights-based approach, policies, and programs, and in water issues as in other issues of human rights. In the case of the human right to water and sanitation, the indicator seeks to measure the commitment to human rights standard of responsible entities such as local governments, water and sanitation service providers, and water and wastewater authorities. There is a policy brief which was produced by Human Right to Water and the International Water Resources Association on the topic. You can find it on the webinar on the websites of both organizations. The policy brief is based on a methodology developed by Human Right to Water in cooperation with the Kenya National Human Rights Commission. The webinar seeks to explain the importance of monitoring these human rights indicators. So we will open our webinar with a keynote presentation by Natalia Gullón Muñoz Repiso, the keynote will be followed by an interactive discussion facilitated by Amanda Lofen, which is the CEO of Human Right to Water, and Amanda will have with her speakers from the Office of the High Commissioner for Human Rights, the Kenya National Human Rights Commission, and Kenya Rapid, which is an NGO based in Kenya. Now, I don't want to take much time from the interesting discussions that we were going to hear and leave you enough time to interact with the speakers. I would like to introduce Natalia Gullón Muñoz Repiso. Natalia has a background in civil engineering. She works for the Cooperation Fund for Water and Sanitation of the Spanish Agency for International Development Cooperation. The objective of this fund is to support Latin American countries in the realization of the human rights to water and sanitation and to achieve progress towards SDG for the sector. The fund focuses on programs providing sustainable services through infrastructure, strengthening public management systems to become efficient, transparent, and participatory, and through capacity building in the public institutions and organizations of the countries. The fund works with the human rights approach and inserts its program in a result framework with indicators reflecting this approach. And the fund has also developed practical tools such as the checklist for assessing inclusion of human rights, water, and sanitation in development projects. Natalia, please, the floor is yours for about 7 minutes to introduce us on the topic. Thank you.
Thank you very much for the invitation to participate in this interesting event. As you said, the promotion of the human rights to safe drinking water and sanitation is one of the priorities of the Spanish cooperation policy, and its main commitment and financial instrument is the Cooperation Fund for Water and Sanitation. We work in Latin America and the Caribbean. I want to say that it was created with the aim of realizing the human rights to water and sanitation, and it prioritizes fragile countries and the most vulnerable populations. I will tell you when you have to go to next. You can stay there. Thank you. For me, it is really a pleasure to be in a webinar that talks about human rights to water and sanitation and indicators, because it means that we have already traveled a long way. Today, we can properly speak of human rights to water and sanitation, but 12 years ago, they did not exist as such. Recognition by the United Nations was also a very long road, in which, by the way, Spain has played an active role, along with other institutions and other countries, promoting different resolutions and supporting the UN Special Rapporteur, as you know. Now, the challenge concerning these rights is their effective implementation. And for this, we must measure progress, analyze which processes give good results, what proposals help us better achieve our objectives. because if we don't measure the results, we don't know the real impacts. Therefore, indicators for human rights to water and sanitation are necessary and important. I think that we all agree on that. Now, the challenge is how to develop them. Next slide, please. Well, a few weeks ago, I traveled to Ecuador to visit our projects there, our water and sanitation projects. And in Puerto Viejo, Manabí, the Spanish Corporation supports a program for water and sanitation in rural scattered areas, which is complementary to a large credit operation, right? And there was this admirable woman, the leader of one of the rural parishes, well, the president of the rural community, whose name is Johnny, and she spoke in front of everyone. You see there were hundreds of people, the mayor, the international financial institutions, technical experts, all the neighbors, and in front of everyone, this woman stood up and made a beautiful speech. And her face lit up when she finished saying, "I will finally sing in the shower." Wow, this sentence summarizes everything, doesn't it? I will finally sing in the shower. This declaration concentrated all the indicators of the human rights to water, sanitation, and hygiene. Next slide, please. Does this woman enjoy a sufficient amount of water for her hygiene? Clearly, yes. Availability, accessibility. Moreover, it will have adequate quality and it will be affordable because we have carried out a tariff study. We have analyzed the payment capacity of the people who live there in the rural areas. And of course, the acceptability criteria are also met because we have been working with institutions and the communities for 2 years. They themselves have participated in project decisions. Women have collaborated in the elaboration of the baseline. So participation, universality, equity, accountability, sustainability, cross-cutting principles, you know. And she is a right holder, isn't she? But this woman, Johnny, she didn't talk about any of these criteria, any of these principles. What she said was, I will finally sing in the shower. Can the indicators for human rights measure this joy? How do we quantify the intangibles involved in having access to water and sanitation at home, at school, at the health center? Do we measure the change in life, the increase in income, the time saved to be able to study, the changes in power relations, the courage to speak in public? Therefore, when measuring, we have to bear in mind that it is a process and it is important in itself, and it can evolve over time, of course. In the Water Fund for Sanitation and Water, we have carried out our own process to identify and improve our own indicators, and we have drawn some conclusions which I want to share with you. First of all, what do financing entities measure? But also, and above all, what and how do the beneficiary communities want to measure? What is important for them? And you know that the process in itself is also very relevant. This is the progressive realization of human rights, right? Secondly, indicators we know that have to be very tailor-made. They have to be fit for the specific context. And of course, always pay attention to the most vulnerable people. Moreover, we must look for quantitative data, but also qualitative information, and carry out in-depth interviews to better understand the communities, to better understand everyone in the community. And remember the importance of carrying out evaluations, intermediate evaluations, final evaluations of the programs, but also ex-post evaluations. 3 or 4 years after our intervention, what is the situation? What benefits have been maintained? Moreover, what unexpected improvements maybe have taken place in the community, or in which aspects the expected objectives were not achieved, right? And finally, it is very important to measure indicators, but also to develop practical tools. The speakers today are going to tell us how they have done it in Kenya. And well, in the Cooperation Fund for Water and Sanitation, we have developed several tools. For example, with the help of an NGO, Ongawa, We have launched a checklist for assessing inclusion of human rights to water and sanitation in development projects. Raya said before, but well, this practical tool allows us to analyze in detail whether all the criteria and the principles of these human rights have been considered in our projects. I'm not going to explain it now, but it is available online. It is free. You can download it in English, in French, in Spanish, in Portuguese from our website. And right now we are developing a new tool with Ongawa also, specifically designed for municipalities, rural municipalities, so they can analyze themselves if they are meeting the human rights to water and sanitation criteria, and they also get many inputs to improve their performance in this area. But going back to Johnny, I will finally sing in the shower. This happy phrase also hides very invisible dimensions of dignity, human development, opportunities, because the rural women of Puerto Viejo, I can tell you that they have benefited from training on the management and use of water resources. They have been empowered. Now they dare to stand up in front of everyone and raise their voices because they have something important to say, something to contribute to the community. And above all, they have a future. They have been trained in construction with bamboo. They have been trained in gastronomy, and now they are thinking of building a restaurant in the rural area that will, of course, give them a source of incomes to pay the water bill, but also for many other development opportunities, right? So I will finally sing in the shower. This phrase alone teaches us how important it is to be able to work on all the dimensions of the human rights to water and sanitation, and to be able to measure them with indicators. Human rights indicators that will go beyond the human right to water and sanitation, because they also imply other rights and other sustainable goals, you know, such as food, education, gender, environment, health. I am sure that today's meeting will help us to improve, to learn, and to advance together in the challenge that I propose today: how to measure the intangibles of development. Thank you very much.
Okay, thank you, Natalia, for your introduction to the topic, and thank you for telling us this very nice story that illustrates really what the human rights to water and sanitation brings to people. As you said, it's also intangible things that we don't necessarily measure. Now, I would like to hand over to Amanda for the second part of the webinar, for the interactive discussion. And please don't hesitate to put questions in the chat for our speakers. Amanda, over to you.
Thanks, Rhea. That's very kind. I really enjoyed that presentation, and from Natalia. I think it's set the scene for our next discussions. And I'd just like to make the point that if you have questions for Natalia, please put them into the Q&A, because we are going to have time to ask questions specifically of all the speakers today. So if it's okay with you, we'll wait until later in the session. So for the roundtable, we have 3 speakers. Our first one is from the Office of the High Commissioner on Human Rights. As mentioned earlier, OHCHR produced guidelines for human rights indicators in 2008 that they developed in request from the Intercommittee meeting of treaty bodies, asking the Secretariat to undertake validation of the approach on the use of statistical information in states party records, develop a further list of indicators, and submit a report of this work to the 7th ICM. And this report outlines the adopted conceptual and methodological framework for identifying the relevant quantitative indicators as it's evolved over the last 2 years. And it discussed the relevance of using the configuration of structural, process, and outcome indicators for the said framework, and highlights some considerations in the selection of illustrative indicators on different human rights. So with that introduction, I'd like to present Sine Tepe, who comes to us from OHCHR. She's a statistician for human rights indicators and the data unit, and under the methodology, education and training section of UN Human Rights. She works on the development of methodological guidance and good practices on the use of data for human rights measurements and indicators. And she's previously worked as an economist for the UN Conference on Trade and Development and the UN Economic Commission for Africa, conducting research and providing advisory services on development issues and priorities of African countries. So, Cindy, I'd like to hand the floor to you and ask you to please present to us your thoughts on human rights indicators.
Many thanks, Amanda. Good morning, good afternoon, good evening, everyone. As Amanda mentioned, I'm a statistician working at the Human Rights Data and Indicators Unit at OSHR, and it's very exciting to be part of this panel. I will briefly talk about the development of human rights indicators for water and sanitation and provide some examples from the work that we have done so far. But before that, as previously stated out by Raya and Natalia, safe drinking water and sanitation facilities are indispensable to meet the development goals, reduce child mortality, improve health in a sustainable way, and they are fundamental to the dignity of all. However, if you look at the most recent statistics, they shed light on a worrying situation, despite the progress in over 2 decades. Today, 2 billion people lack access to safe, readily available water at home, including 771 million who are even without even basic drinking water. 2.3 billion people worldwide, which is approximately 1 in 3, still lack a basic hand washing facility with soap and water at home, and 670 million have no washing hand facility at all. And actually, the reality is much worse, as millions of poor people live in informal settlements, and they are simply missing from the national statistics, official national statistics. In order to address this crisis, the water crisis, the international community has increasingly recognized that access to safe drinking water and sanitation must be considered within a human rights framework. There has been a growing momentum since 2010 towards achieving equitable access to water and sanitation at a global level after the adoption of the 2010 General Assembly resolution, which explicitly recognized the right to safe and clean drinking water and sanitation as a human right that is essential for the full enjoyment of life and human rights. Furthermore, since 2015, the General Assembly and the Human Rights Council have recognized both the right to safe drinking water and the right to sanitation as closely related but distinct human rights. They are therefore a legal obligation for the states. And within the context of the 2030 Agenda, Goal 6 includes targets specifically addressing access to equitable, safe, sustainable water and sanitation services. So how do we monitor the human rights to water and sanitation interventions, and how we develop indicators? Human rights monitoring examines water and sanitation in a very holistic manner, looking not only the progress made, such as the provision of water and sanitation services, but also looking at existing gaps and the underlying causes of such gaps and failures, such as legislative, policy, regulatory, and budgeting frameworks. It's of course desirable to have a structured approach to developing indicators. So as a starting point, the attributes reflecting the essence of the legal norms need to be pinned down to facilitate the selection of appropriate indicators. OSCHR developed a list of indicators on human rights to water and sanitation after a true mapping exercise based on existing indicators and frameworks, including the Global Analysis and Assessment of Sanitation and Drinking Water, GLAS. It's a UN water initiative implemented by WHO, and joint monitoring program by UNICEF and WHO, and in consultation with the human rights treaty bodies, United Nations Special Rapporteurs, other UN agencies, policymakers at the local and national level, statistical agencies, and non-governmental organizations, academics, among others. And after this assessment, 4 preliminary attributes were identified. The first one is safety and acceptability. Water quality should be safe for consumption and other personal uses. Sanitation services should be hygienically and technically safe to use, culturally acceptable, and gender specific to ensure privacy and dignity. And the second attribute is sufficiency and continuity. Water and sanitation facilities should be sufficient and continuous for personal and domestic use, and they should be within the immediate vicinity. Affordability. Price must be affordable for all without compromising the ability to secure others' essential needs, such as food, housing, and healthcare. And the fourth attribute is the physical accessibility. Water and sanitation services should be accessible to everyone without discrimination, and they should be in immediate vicinity. After identifying the attributes, the next step is to identify a framework for structural process and outcome indicators for each attribute to measure the progress towards the realization of human rights to water and sanitation. And determining these indicators should indeed allow for some flexibility so as to remain relevant. The first one, structural indicators. They monitor whether the existing legislative, policy, and regulatory frameworks of a state or government at all levels provide an environment that actually encourages the realization of the rights. An example in this context is international human rights treaties relevant to the rights to water and sanitation ratified by the state, or, for example, time frame and coverage of hygiene awareness contained in the National Health Strategy and educational curricula. The process indicators monitor the action taken to realize the human rights. For example, the allocation of resources to services for disadvantaged individuals or targeted groups. One indicator could be, for example, proportion of targeted populations, like children in primary schools, covered by programs for hygiene awareness, including menstrual hygiene for women and girls. Another indicator could be, for example, proportion of households disconnected from the water supply due to the bills not met within, for example, X working days. And outcome indicators, they monitor actual access to water and sanitation services. One example could be, for example, the proportion of population using improved drinking water sources and sanitation facilities. Actually, this is an indicator that is monitored by the joint monitoring program by UNICEF and WHO. So after identifying the indicators, this framework, what comes next? Once the relevant indicators have been identified, the states need to develop standards and systems to ensure that the indicators can be accurately measured and monitored over time. So in this context, we develop human rights-based approach to data that we think will be useful for states to improve data collection and disaggregation efforts, while ensuring that no one is left behind to provide effective solutions. Human rights-based approach to data is essentially guided by 6 key principles. The first one is participation, which is basically involvement of groups of interest in all parts of data collection activities with support of national human rights institutions, civil society organizations, and other relevant stakeholders. The second principle is data disaggregation. Holding up to the data disaggregation principle actually requires more than intense data collection. Sometimes states could benefit from, for example, oversampling or comparative surveys of target population groups with other population groups living in the same areas to shed light on the groups that would otherwise be too small or invisible or marginalized to report on. Of course, these and other methodological approaches in the sample design should be considered on a case-by-case basis using participatory approach. The third principle is the self-identification. For example, if there is a survey and the survey includes questions on personal identity, all persons conducting in-person interviews should receive appropriate training. This may include, for example, gender or cultural awareness training, where information relevant for disaggregation is collected directly from the individuals. The principle of self-identification should be considered. What does it mean? Which means that the target respondents should be self-defining and they should have the option to disclose, withhold information about their personal characteristics. The fourth principle is about transparency, which is basically about providing clear information, accessible information to the research design, the data collection methodology, and making the data openly accessible to the public after the collection. The fifth principle is the privacy. Privacy.
Just note that you're running over time. Thank you.
Okay, I'm about to wrap up. Privacy and confidentiality, actually, they must be considered alongside access to information. An individual's personal information should not be made public. Data should be exclusively used for the statistical purposes. The sixth, the last and but not least principle is the accountability. The data should be used to account on human rights issues, as well as accountability in data collection. To sum up, addressing the challenges of Goal 6 will require water to be not regarded as only a natural resource to be managed and used, but as a fundamental human right to which all people are entitled without discrimination. In this sense, robust indicators will be essential tools for revealing possible violations, assessment of the available resources, implementing and monitoring targeted evidence-based policies and programs. We as OSCHR remain available for providing technical assistance in the development and use of contextually relevant indicators using the list that we developed as a starting point. Thank you.
Thank you very much, Sineya. And I think you gave a good overview of all the indicators that are being developed, including the Joint Monitoring Programme in GLASS, but also an overview of what we're trying to delve into today, which is the rights-based monitoring. And it gives a nice lead into our next speakers. So following on from what I said earlier in terms of the development of the rights-based indicators, OHCHR in that paper said that it was essential that rights-based monitoring process should be country-owned and implemented. And it should be sufficiently decentralized as well as inclusive for different stakeholders to reflect their concerns. In setting up a rights-based monitoring at the country level or strengthening an existing mechanism to monitor the realization of a particular human right, one can identify, among others, the following considerations: identification of monitoring stakeholders, focus on non-discrimination and accessibility indicators, and reporting periodicity, publication and access to information follow-up. And that leads me to our next speaker, Patrick Bonyanzi, who's been working with us over the last 2 years in Kenya. He works as a senior human rights officer at the Kenya National Commission on Human Rights. He holds a BA in anthropology and has more than 7 years experience in project management and monitoring, with the main focus on economic, social and cultural rights, including the rights to water and sanitation. At the Commission, Patrick is the focal point on the right to housing, internal displacement and forceful eviction issues, and is experienced in stakeholder coordination. He's provided technical advice and support for the joint KNCHR and Human Rights to Water programme to build policies for vulnerable people, intergovernance frameworks for water and sanitation, and the integration of human rights indicators. So Patrick, I'd like you to give your presentation if you're ready. Thank you. Patrick, hello.
Yeah, thank you, Amanda. Thank you, participants and the panelists. I'll not dwell much in terms of trying to introduce myself, that has been captured, but allow me to share the experience in terms of developing the human rights indicators to water and sanitation for Marsabit and Garissa counties. Before I proceed, I also love to mention the support that we received from Amanda and our technical team from Geneva towards the implementation of this particular project, which was really valuable. If you allow me, Amanda, I can just switch off the camera and then at least proceed with the presentation shortly, and then I just come back. Thank you. The Kenya National Commission on Human Rights is a state agency anchored under the Constitution of Kenya. Within the Commission, we have different programmatic areas that we work in. One of them being the right to water and sanitation. For a period of about 1.5 years, the Commission received support from the Swiss Agency for Development and Cooperation to implement a project in Marsabit, and the Garissa counties in relation to water and sanitation. And the title mainly focused on leaving no one behind, building policies for vulnerable persons in governance framework for water and sanitation, and considering the COVID-19 in Kenya. This particular project, among other things that we are supposed to deliver, is actually the development of the human rights indicators for monitoring the realization of the right to water and sanitation for vulnerable population and the marginalized individuals within the project area. And I've mentioned about the two counties. Before I proceed, there's one thing that I want to mention about data. In relation to data on water and sanitation, one thing that came out is actually very clear that we don't have adequate data on sanitation. Many of us, we focused on water. Yes, we need to incorporate the two and see how best we'll be able to address those issues. The process, this particular process on the development of the indicators was actually led by the county governments of Marsabit and Garissa through the relevant departments or directorates, and this is water and sanitation, and the other directorate is on health. The National Human Rights Commission, jointly with the Human Rights to Water, provided technical support. Prior to the development of the indicators, several policy meetings were held with policymakers in Marsabit and Garissa counties. These were mainly meant to secure the buy-in or the political goodwill from the two counties. As I proceed again in Kenya, water, a resource is actually a devolved function. Being a devolved function at the county level, they are responsive for a service provision, while at a national level, they're responsive for setting up standards in terms of coming up with policies and legislations. When we had meetings with the county governments, especially the policy meetings, there were a bit of reluctance from the side of the policymakers, in that they told us that they didn't see the need for them to develop the indicators. Reason being, they have infused those indicators in the annual work plans, the county development plans, and even they've gone ahead to establish and equip institutions within the counties to undertake the monitoring of human rights to water and sanitation. Therefore, they felt that they didn't want to have those indicators developed. But with this sustained engagement, the policymakers at some point were able to accept and agree to work with the commission and come up with the indicators. These indicators, we were able to demonstrate to them that we needed standalone indicators for water and sanitation, considering when you look at the plans in place, they don't adequately speak to the indicators that we're discussing at this particular point. What we did, of course, by then in terms of leadership, we tactically had to change the strategy to ensure that at least the counties own these documents, because the commission and the Human Rights Commission, the Human Rights to Water could have developed these indicators, and then at the end of the day, the county governments declined to, adopt those indicators. So that was more or less like trying to request them and lobby for them at least to take the leadership role, of which they accepted. In the planning meetings we held with the county's leadership, we were able to secure the participation of the top level management. These are the directors for water and health. And among other things that we were able to do jointly is actually to come up with a membership in terms of a smaller team to come up with the indicators. One was actually, we were able to secure the participation of the county directorate on matters legislation. And these are what we call the county attorneys. These are actually the entity responsible when coming up with policies, legislations that govern or guide the county in terms of their undertakings. And then we also got the support from the departments of water and irrigation, Department of Health, and then we also got another support, probably support from water and sewerage companies working in those particular counties. We had another national level. At national level, we also got support from the Water Works Development Authority. And also we got support from the non-governmental organizations working within that particular locality. And the reason as to why we had to go for this particular strategy was actually to ensure efficiency and easy coordination of this particular process. What we did again, we brought together the technical teams comprising of about five from each county to a central place. And this was actually for us to secure maximum concentration towards the development of coming up with these indicators. They were taken through the human rights concept, the right to water, and the human rights-based approach concept, because this is actually now the bearing where we anchored the development of our indicators. The technical team also came up with the draft roadmap, just a layout on how the indicators should be, the format of the indicators, which was discussed, and the teams agreed to that particular layout. The information contained the human rights indicators that we've developed was actually through a comprehensive desktop research involving the review of available literature in the water and sanitation sectors. The indicators also borrowed heavily from the findings of the situation analysis report that we had already done under the project targeting Wajir, Marsabit, and the Garissa counties. And again, the specific focus was given to existing legal framework, policy frameworks that govern the sector, thereby linking the indicators to strategic county policy documents, including the county integrated development plans, the annual plans, and the departmental plans. And when we talk about departmental plans, focus was on the right to Department for Health and Department for Water. These particular indicators, they are actually tailored to fit the county specific situation with an anchorage on the protection needs of vulnerable population within that particular project area. We ensured that the indicators are of a reasonable number, made sure that they are simple to understand and measure. They relate to the actual problem being experienced at the community level within that particular locality. They translate, they're able to translate them, that particular data, when it comes to a monitoring angle. We came up with 3 levels of indicators, of which I'm not going to dwell much on that, because seen from the OCHR as already by they spoke about those indicators. We targeted on the structural indicators, the process indicators, and the outcome indicators. And when looking at the structural indicators, of course, these particular 2 counties, they have legislation on water and sanitation. But again, there are some issues within those particular legislations. They don't speak to the vulnerable population. So we're looking at that particular angle of seeing at least we have laws in place that speaks to the needs of the vulnerable population within the counties. The other one is about the process indicators. We also looked at the outcome indicators. Again, something that has been mentioned about the use of the human rights principles in the development of the indicators. We ensured that there's an element of public participation. There is accountability, non-discrimination, transparency, human dignity, empowerment, and the rule of law. And again, we also use the 5 cross-cutting criteria in the development of the indicators. We're looking at the availability, acceptability, accessibility, affordability, and the quality. When we talk about the quality, we're looking at the quality of water and the quality of sanitation services being provided within that particular locality. After coming up with the first draft of indicators, they were subjected to validation. Validation forums were held for various stakeholders, including the targeted communities. And when I talk about the target communities, it's actually the vulnerable population, including persons with disability, elderly, or the older member of society, women, water users associations, water vendors, representatives from the pastoralist communities, the policymakers, and the politicians. Through these, politicians were involved through the county assemblies, committees, under water and sanitation. And then, of course, all this process, we had a number of challenges. But again, I'll just mention a few. There was a bit of reluctance from the part of the leadership of the two counties to accept the need to develop specific human rights indicators for water and sanitation. And when there was lengthy discussions for to secure the political goodwill from the two counties. The insecurity, of course, those particular localities also faced with insecurities here and there. So the project, during the implementation, we also had to navigate those particular challenges and see how best we could come up with these indicators, especially now the convenings of developing the indicators. We also had what we call inadequate participation of policy level teams. The policymakers, at some point, they were not really focusing on this particular process. But I'm happy to report that they were, at the end of the day, they accepted and adopted these indicators. And then there was another issue in Kenya right now. We have, we're actually in the political mood, and the next few days from now, we're going to our general elections. So at the county level, we didn't have
Have we lost Patrick there? We can't hear you, Patrick. Do you want to maybe catch your video and see if that works? While we're waiting for him to come back, I think one of the strengths of working with the Kenya National Human Rights Commission is their contact with local politicians, government officials, and their ability to influence policy. And this was very evident right from the very start in terms of the selection of stakeholders that they got engaged to try and get ownership in the process right from the very beginning. And so the same group of people, both representing local government and also the different vulnerable groups, were gathered together on a regular basis over those nearly 2-year period during the development phase to understand what the challenges were and set up the baseline, understand what the existing policy was in the region, and then also to try and establish indicators that could measure at a disaggregated level what was needed really in terms of changes in those regions. They're in the north of Kenya, in case you don't know the geography, in Marsabit and Garissa, and it's a pastoral community with nomadic peoples as well. So it was an interesting study. So I think we might have lost Patrick temporarily, but maybe he can come back for the Q&A. Let's move on to our next presenter. We have a speaker who's on behalf of Kenya Rapid Plus, which is a 5-year funded program by SDC and USAID that brings together public and private institutions to provide water and sanitation for people and livestock in the northern rangeland areas of Kenya. The goal has been to increase access to water from 37% to over 50% in that region. And this team has been involved in the program from the beginning, such that water can be brought to some of the more vulnerable populations. So it was quite useful to work with Kenya Rapid Plus. And one of the managers of that operation is Stivers Kathuni, who works at the Millennium Water Alliance as the country representative for Kenya and program director for Kenya Rapid Plus. Stivers has worked for over a decade in design and management of water, sanitation and hygiene activities in Africa. And prior to joining MWA, he held various positions in the technical and project management of water programs with NGOs and private companies, such as Sweet Sense, Save the Children and Catholic Relief Services. Thanks to his Masters in Water Supply and Sanitation from Kenyatta University. So if I can hand over the floor to Stivers, I think he's going to give us a little bit more of a feel for some of the challenges in that part of the country and some of the experiences he had in joining with the stakeholder engagements that we were conducting in the area with the National Human Rights Commission. Thank you, Stivers. Patrick is back. Patrick, why don't we let Stivers speak, and we can ask you some questions, or have you got much more you wanted to say? Patrick.
Sorry, Amanda, for that lapse. I can't tell exactly where I got lost because.
I think why don't we move over to Stivers to keep things moving along, and because I've just introduced him, and then when we get to the next section on discussion, people can ask you questions, and we can understand what it is that you didn't finish. Is that all right?
That's fine. Let's proceed. That's fine.
Okay, thank you. So, Stivers, would you like to give your impressions? Thank you.
Thank you. Good morning, good afternoon, good evening, everyone. My name is Stivers, as you've heard, and thanks, Amanda, for the introduction and the opportunity to speak to you from a practical point of view of project implementation. I work for Millennium Water Alliance, and Millennium Water Alliance is an alliance of several NGOs, global NGOs, including World Vision, CARE, Food for the Hungry, Save the Children, and this action against hunger, and many of these who are leading in humanitarian work in the water sector specifically. We come together as members to really push forward the agenda of making sure we have water and sanitation access and sustainably being accessed by communities and hopefully feeding into the SDG. Our work in Kenya particularly, and in the context of what we are speaking about today, has been, we work in the northern parts of Kenya, which are really arid and semi-arid. And we've been in these areas for quite some years. From a practical point of view, we have, some of our members have worked here for over 20, 30 years, and we really understand the context of what it means when we talk about human rights to water, because these are communities that are really marginalized. They don't have access to water, and some of their access numbers or numbers are really low. We have seen an evolution from as low as 10 to 20% to the current levels of where we're trying to push them beyond the 70% mark. Our work for the last 5 years has been to make sure that we move them from 35 on average to about 50%, which we accomplished by last year through the efforts of many other government intervention, other government entities, but also from a lot of donor funding. I would like to acknowledge the funding that we've received from USAID and also the funding currently that we are running, and the Kenya Rapid Plus from the Swiss Development Agency and Corporation, for Development and Cooperation, that's SDC, which actually funded the same study that Amanda and the team here is talking about. So we have a common donor, and also what we know is that that donor also has a very keen interest in making sure that we increase access to water in these areas. Moving forward is that our work in these areas, we have been making sure that we continuously monitor some of these human rights indicators, not going into the details of some of the indicators that have been spoken about here, but also just to let you know, we have a multi, I would say, a multi-stakeholder, but also a wide range of approach in how we approach issues to do with improving access to water. So one, we do a lot of infrastructure development, which requires a lot of monitoring, a lot of assessments, making sure that we are actually doing infrastructure that really responds to accessibility, availability, quality of water, affordability, and all these. So that's is an area we've had a lot of experience on, but also looking at the context of the policies and the strategies and the laws that exist. We've been in the front line trying to push for the enactment of laws that really respond to human rights to water. One of the key things we've done across the 5 counties that we work in, I think 3 of which are being discussed here where the study was done, we've managed to pass laws that are really very specific to making sure that the counties or the devolved structures of government in Kenya are in line with the national government laws and policies that helps us to really put the law and the policies in the context of that particular area, which might not really apply to the other areas in Kenya. As I started by saying, we have areas that are really marginalized and are semi-arid, and actually most of them are arid areas currently in a drought situation. The other thing to note is that as we progressively support the laws, we also look at the pricing of the water, supporting how water tariffs are being set, and that really speaks highly around the affordability indicators, which we try to make sure that we are making sure that the communities are accessing water, but also in a very affordable way, but also with a sustainability mechanism built into that to make sure that the water is, the systems that we put in place are sustainable. The other thing to note is that of late, we are coming to realize about the marginalization and also the segregation of some of the units in the communities. For example, we've seen, in some of these communities that the women are being left behind. And remember, our goal is to leave no one behind. So making sure that we come in with a gender lens, making sure that we are setting indicators that are responsive to the gender perspectives as we monitor, trying to make sure that as you ask some of these questions that we do the continuous monitoring and periodic evaluations, we are also asking these questions around the gender perspective. The other thing we do is also come in with a bit of resource-based conflict perspective, just making sure that we are not bringing conflict or causing harm in some of these communities by bringing in water infrastructure, but also as all the actors come into place, put all this water infrastructure and systems for increasing access and availability. How do we do that in the context of making sure that there is resource sharing that doesn't bring conflicts? Some of these areas have serious conflicts that we work in because their pastoralist, their nomadism way of life makes them move around, and making sure that we have water being accessed in a way that there's sharing of the resource that is available. The other thing to note is that on a very practical perspective is that we do recognize that, government, who are the duty bearers and the NGOs or all the actors working in this place cannot do this without the acts of or the support of some of the private sector partners. So as a program, as Millennium Water Alliance, we are coming in place to make sure that we are carrying on board our private sector partners who are really in this space. But most importantly, get used to creating indicators around how do you monitor the work or the improvements by private sector in terms of creating that availability and access to water, but at the same time, making sure you're not infringing in their space and making sure that you're being supportive of the work that they're doing. So we've worked together with some of these private sector partners for the last 5 years, and we're moving forward for another 5 years. That will be a 10-year duration of working with some of the key private sector partners who we are trying to change the mindset or also teach them or talk to them about human rights to water indicators and how to their work also contributes to providing access and equitable access, for that matter, to water resources in this area. Finally, it's just to let you know, we also have realized that it's not just a matter of just talking to to the communities or monitoring the work that we're doing and using all these fancy indicators that we might create, but also making sure that they're understood by the communities. They know that it's their right, but also the government entities knowing that they're the duty bearers in this. So one of the key things we're doing is we've negotiated and now sit in the county government offices. Our staff who are out there are co-located in the county government offices to make sure that even as these laws are being passed, as the government realizes that they're supposed to be the duty bearers and provide some of this water infrastructure, we are there to support them. We are there to make sure that they are cognizant of the fact that these indicators exist, but also do this in the context of being a facilitator and not really infringing on what the government should be doing or some of the work that the communities are holding the government accountable to. MWA, that's Millennium Water Alliance, and the partners are happy to be part of this forum and also looking out for questions that we can answer as we move along. Thank you.
Oh, thank you, Silas. And it's interesting to hear from your perspective as well as representing not just an NGO, but also the private sector and other solutions. And I know you've been involved quite heavily in some of the meetings that Patrick was organising. But I think what it highlights is that we need different indicators in different situations. You can't assume that the same indicators will apply across the board, and that was one of the areas that we spent a lot of time in terms of developing specifically which indicators are needed for those particular counties that we were working in. So I would like to open the floor to questions and cross questions now. There's a lot of beautiful information there, and I've got loads of my own, but I'd really like to see if any of the panelists themselves would like to ask each other questions about their particular presentations. So please raise your hand with the button at the bottom, and we'll start with that, and then we'll open it to the attendees as well. Thank you. who would like to go first? Do you have any questions for each other? Why don't I start, and then maybe that will prompt some thinking. So I suppose what I'm interested in is, where do we go from here? We've done a lot of theoretical work. We've, thanks to KNCHR, we've actually been able to develop these, to integrate some of these indicators into local county action plans. And the next stage is for them to be monitored. I suppose, Patrick, if I was to go to you first, using you as an easy example for a lot of the theories that we're talking about today, what do you think we need to change in the way that we approach things to be able to make this more replicable and scale it up across the country? Because we worked in 2 specific counties where we had specific needs, specific vulnerable groups, and we were looking for which, you can't measure everything. So we had to measure the indicators that were the most important for those particular regions. How do you think we could improve things?
Thank you, Amanda, for that question. I'll go first, I think. Having worked with the 2 counties, one thing that we discovered is that they haven't really, in Kenya, counties haven't focused much on the right to water and sanitation. There has been mainly on infrastructural development. In that, when it comes even to programming, daily counties just program around the right to water and sanitation. And for me, my approach will be just to reach out to the county governments, have candid or congent conversations for them to have, a buy-in, for them to take deliberate measures, more so looking at the county's legislative frameworks. Because if the counties, they don't have laws in place and they don't have comprehensive plans in place, and then it becomes a bit difficult for them to intervene, because in other areas, what you're seeing is actually reactional. For us, what we're looking for is actually sustained, interventions towards the enjoyment of these particular rights. And for instance, when you look at even the counties where we work in, the 2 legislations that they've been able to come up with, and I really appreciate the support. We were told that they got a lot of support from the Millennium Water Alliance in terms of mobilizing the resources for them to come up with those legislations. If you have those legislations, they looked at keenly, and then ensure that at least they are aligned with both national, international obligations, at the end of the day, will be able to address these particular concerns that we're discussing today here.
Which I suppose that leads me to ask Ms. Stivers, from the other side of things, integrating the 2 approaches, one sort of a bit more top down, as you've described, in terms of pulling down the law and policy into local level, and then from the NWA, Kenya Rapid point of view, where they're pushing new technologies and resources into the sector. Bringing those 2 together is obviously very important, and it sounds as if you're working together quite closely. Stivers, do you want to comment on that in terms of how do we optimize that connection between the accountability of the local government and the integration of indicators that are a bit more human rights based, and the work that you're doing? I know you've talked about programmatic indicators, so do you have a comment on that?
Yeah, thanks, Amanda, for that. I think from our view is that we've read the documents from Kenya National Human Rights, what the entire work that you've done, and the key thing is that they don't really differ a lot in terms of what we have as programmatic indicators, but I think they spice and they add value to us, bringing everyone to think about human rights. Like, all what you're monitoring should have that human rights angle. My take on this would be that the county governments have departments that they call monitoring evaluation departments that we should start working very closely with. Most of the counties we work with, in the 5 that we work in, have specific monitoring and evaluation staff who work in the departments, but also at a national level, at a county level. I think the opportunity presented to us, I think Patrick mentioned that in Kenya currently we have general elections. Most of, in the next few days we'll have new governments coming into place. I think in the context of Kenya, it presents a nice opportunity for us to work in with some of these indicators, to work in with some of these documents and have these discussions with the new regimes that are coming in, and making sure that they own up or they feel that to be part of that process of us trying to show them. By you taking up this as you work for your communities and the people that voted for you is important. I think it's a nice starting point. We have a program, for example, that the one I run here, known as Kenya Rapid Plus, which is running for the next 5 years. For us, we see this as an opportunity to start off with a 5-year regime of the next government, to discuss with them some of these indicators, how they get into their work plans, how we support some of their work plans, but be in the room with them, work closely with them, because ultimately this is they eventually dictate many things. They dictate budgets, they dictate many things that really eventually lead to human rights being realized for water. So my take is to continue working closely with the government. And yeah, for us, we have our outcome, our goal indicators, our output indicators that we are actually trying to tweak and make sure we can align them with these indicators that have been talked about. The last point I wanted to mention on this is that one point was raised on the process. I think the process is very key for us. We are trying to make sure that now we have process indicators that really speak to the entire chain of events that or activities that we implement, but also doing something we call outcome harvesting early enough, making sure that we can show that the outcomes that we are realizing. And I like the story about the shower, that was told by Natalia, that eventually the outcome we want to realize, how do we harvest it? How do we make sure that we can show the process? Because we've seen that's where it gets tricky, because some of us get bogged down by just counting the numbers. You want to know how many people you reached, how many people have, how many water points, so much on the outputs, which I think is we might now have to change our ways and try to think about the processes, the outcome harvesting, and how best to make sure that we have the stories, many stories such as the shower story that we were told.
Which I think maybe opens the door for Natalia to comment on this in terms of, it's all very well having the local authorities involved, but actually how do we get programs like the ones you've been working on to support that and still give accountability without removing the accountability of the local government? So if your program is developing human rights indicators, we don't want that accountability to rest only at the program level. We want it to be lifted to the government or the local council, whoever that might be. So are you doing work on that to try and integrate it as well?
Well, we normally work very closely with the local governments, with the local communities or the institutions, the service providers. So what we normally do is try to build capacity on human rights to water and sanitation. But that is not easy, because sometimes they don't want to hear about human rights to water and sanitation. They don't understand duty bearers or right holders, all this vocabulary that we have. And for us, it's very common, but for them, it's very strange. So that is why now we are developing this very, very practical tool to introduce municipal governments at the rural areas to this world of human rights. Sometimes not calling them human right to water and sanitation. We're not going to say acceptability or affordability, because this is complex for them, but we are transforming these concepts into easy questions, which are a little bit pedagogic also. They are going to be like training on human rights towards sanitation, but through a very practical tool for municipalities. That is what we are working now.
Okay. Thank you, Natalia. I think it would be good to invite a couple of members of the audience, because I noticed they have questions, but they've also put their hands up. So why don't we allow Mufle is top of my list here. Mufle, would you like to ask your question and direct it to the panelist that you think is most suitable for you? Mufle, I noticed you're still on mute, so you need to unmute yourself to be able to speak, but I've given you the floor. So not there at the moment. We'll come back to him. Anand Chipanka, maybe you could ask your question. Would you like to do that? I can't.
Yeah,
I can't see you yet. Okay, great. Hello.
Yeah, hello. This is Anand here. I was earlier working in the Asian Development Bank, and one of the challenges which we always had was about the data requirements. I had a question that for human rights to water, what are the additional data requirements you need to monitor the indicators?
Who are you asking the question to?
Oh, sorry. I'm asking this question to Natalia.
Okay.
Sorry, could you repeat the question, please? Because I didn't understand the whole.
It's in the Q&A. He asks what additional data requirements do you envisage to measure human rights to water and sanitation?
Okay, thank you very much for the question. It's really interesting. I don't know. Well, I mean, what we have seen after 12 years working in water and sanitation in different countries, we work in 18 countries in Latin America with 81 programs, so we have quite an experience. And what we have seen is that the results of our programs go far beyond the realization of human rights to water and sanitation, which is our aim, because these actions are like a catalyst for other processes. For example, dignity. I remember when I visited Cartagena de Indias in Colombia, there was a very, very poor peri-urban area. And they said, now that the water and sanitation has been built, the infrastructures have been built, now the street has been paved. Now we don't have the street in sand and mud. Now the street is on, I don't know, concrete or whatever. And this gives dignity. So there are very invisible processes that take part. No? For example, they said also, my bathroom was the most beautiful room in the house. And when someone came to visit me, I wanted to take them to the bathroom because it was the most beautiful room. So this led them to improve all the house, right? So this is dignity, this is development, and sometimes we are not measuring it because we don't see it. That's why I say we have to carry out evaluations, and then in the evaluation we see what is happening, and then we try to measure it. For example, there is a very clear impact on health. In many projects we have measured, for example, how many illnesses related to water were before the project and after the project. This is another impact, no? Or maybe the impact on employment. When we are building infrastructure for water and sanitation, there are some people who can work on building toilets or making the doors for the toilets. Or there was this old woman who created a very humble bakery because she could bake bread because she had water. Or there was another woman who made ice creams because she had water. So all the things, maybe you don't know them before the project, but you know them if you evaluate the project at the intermediate phase or after the project. And then you realize that you can measure all these kind of things, but it's not easy. It has to be tailor-made to the context, to the project, to the country, to the community. We have to be very creative, right?
Yeah, in fact, I noticed.
Yes, they are welcome.
Thank you, Natalia. That reminds me of one of the stories we came up with when we were interviewing people in Marsabit and Garissa, and it was to do with children and access to toilets in schools, and how do you measure that in a way that is related to health? And it is sometimes completely disconnected with the actual toilets themselves. It can be attendance at school, for example, as a way of monitoring. And so it is very disaggregated and tailor-made, as you say. So we've got some other questions here. One from Johnson Nganga, who asks, how far are the counties with the indicators since they were developed in Marsabit and Garissa, and are there any plans on dissemination and actualization? So I think that's a question for Patrick. Patrick, did you hear that? It's in the live Q&A.
Yes, I got the question. Thank you so much for that question. One thing that we've done is actually to ensure that we have those indicators in place, and with the resources, available, we'll be able as the Commission to now go back to monitor if at all the counties have been able to infuse or to adopt those particular indicators towards ensuring that at least they've been implemented. So, of course, I'll also take an advantage of this particular question to mention one thing about the sustainability part of it. Is actually, we see a possibility for counties also going to learn from one another or from each other in terms of how this particular process was carried out, and more so on how they be able to infuse within the indicators within the existing frameworks. So for us, what we are focusing on at this particular moment is actually, once we are done with the elections, we will definitely go back to the counties to undertake more or less like a monitoring exercise to see if at all they've been able to infuse these particular indicators into their programming. And again, the other thing is about the planning cycle. The counties will also be looking at the county integrated plans and the county, departmental plans to see if at all these particular indicators they've been, adopted. But in terms of dissemination, these documents, they're actually online at the Kenya National Commission on Human Rights website. And we also had a discussion with the counties to ensure that at least they disseminate these indicators within different parameters, within the different stakeholders that they work with. And the other thing is about within the two counties, they have county structures on water and sanitation. So we also look forward for those particular platforms to be used as anchorage for dissemination of the indicators.
So I think also we've had the discussion about how do we replicate this in other areas as well. So dissemination, not just to the areas where we've been working, but to the wider country and also to the African region. So we have another question here that may be more for Sine, from Emmanuel Olela. He says, how can WASH projects incorporate human rights to water indicators without feeling overwhelmed with data collection and constraints resources, especially where we'd like the government to lead and there are quite a number of indicators, not just affordability, accessibility, etc. But I know this from experience because when we were pulling together human rights indicators for the counties, there's hundreds. And so that's why you actually have to focus in on what are the challenges in those particular areas. But perhaps Sine has another perspective on that.
Amanda, could you repeat the question? Sorry, my connection is very big.
Okay, it's in the chat. It's the about third or fourth one down from Emmanuel Olela.
I had to connect.
And it's about the overwhelming number of indicators. If you're really, I think what he's trying to say is if you really want to assess the human rights to water and sanitation, there are hundreds of indicators you could be measuring. You obviously can't do that. So how do you manage this, given that we have limited resources? I know with the projects that we've done in Marsabit and Garissa, we ended up with we reduced it based on an understanding of the situation to 1 or 2 structural indicators for each criteria. 1 or 2 process indicators that were connected with that, and then maybe 3 outcome indicators that were linked to that same issue. So connection between the different levels to really try and build that integration of law and policy through to process and outcomes.
Mm-hmm. And another thing that is really important when you look at the process and outcome indicators, not necessarily structural indicator, is the data availability. So I think it's really important to narrow down indicators based on the data availability, based on the disaggregation, because those are the things that we want to look at. We want to also focus on the marginalized population. We want to target certain segments of the population. So that's another way of narrowing down the indicators if it is available for the localities that we are looking at.
Yeah, I think that's why we started at county level, because you need to look at it on a very localized basis to really understand what needs to be done. And so it's going to be an interesting process to try and replicate that in other areas, because it's the methodology that gets replicated rather than the actual indicators.
Mm-hmm.
On
that, I want to actually ask a question. I missed part of the question and answer session because of my weak internet connection, but where do the panelists stand in terms of the data collection? Because we've been talking about this conceptual framework, talking about the indicators, but did they actually start collecting data, and did they work with the national statistical offices? Is there any collaboration ongoing?
Patrick, I think that's for you.
Currently, we've been working with the National Statistical Office or Department in a number of areas, especially in terms of trying to come up with the data to help at least in a number of interventions. So as we speak right now, we don't have a specific targeting a project targeting data collection in relation to this particular area, but with the resources, allowing, those are some of the things that we intend to do as a commission, because many times without data, definitely you'll not be able to advance their discussions. And again, you'll not be able to, ensure that at least even the laws that we come up with, or the policies that we come up with, they're geared towards addressing a particular issue. So in Kenya, what we're doing right now is actually looking towards securing resources and focus on that particular sector in terms of coming up with the data.
My understanding too, Patrick, from the process that's been going on at the county level is that there are some resources already at the county level, and they need to mark some of them for developing the monitoring process. But this is quite a new area, so it does need investment at this point. I have some other interesting questions actually that I want to try and get to before we finish. One here from Zimbabwe, which is interesting because it would be very nice to see if we could do similar things in other countries, especially across Africa. This is from Kambalani Mafosa, if I've said that correctly, who represents the Institute for Human Rights in Zimbabwe. And his question is on budgeting water services. And he said, so topical, sometimes our government, our national and even local governments adopt indicators, and then when it comes to budgeting, they also allocate fair budgetary resources to meet water indicators, but the actual disbursement of the fund isn't done, and where it is done, there's little funds and no accountability. So how can we improve that? So I don't know if anyone who would like to answer that. That's either, I think that's either, it's probably Patrick again, but it could, yeah, go ahead.
Sure. That's a very valid concern or question. And I thank the member for raising that issue. This one, I'll answer it from a perspective of the experience in Kenya, in that many times you find probably you've come up with a nice work plan. You've come up with, a projection work plan that these are the things that you want to do. But again, at the county level, they're being funded by the exchequer, the national government. So many times you find a situation where they even receive funds late. And they're supposed to implement particular projects. So they don't even have enough or adequate time to implement those particular projects. And in the long run, you find a situation where that particular amount or the monies goes back to the national government. So the timing of planning and the timing of disbursement of funds to counties also, by the way, is a very big challenge here in Kenya. So the other thing is about planning and the budgeting aspect. Yes, you have a projection in terms of what you want to do, but again, when you raise that particular request with the probably Treasury in Kenya or the Exchequer for them to fund that project, they just disperse the money, yes, but the money, not necessarily by the goes to that particular project that you intended to, to implement. But again, the money comes not necessarily for that intended purpose, but again, that money is redirected to a different project, but in line with what you had initially requested. So yes, it's a very big challenge. And in Kenya, what we're doing as a commission is actually trying to engage both the county governments and the national government to ensure that at least there is timely disbursement of funds to counties for them to be able to implement a particular project. So when you're coming in to monitor those using the indicators, it might get to a point where probably you might be penalizing the counties for having not implemented that particular indicator or achieved that particular indicator, yet there was some other constraint the county had faced. So I think it's an area that we also need to discuss and see how then at least we can enhance advocacy strategies to ensure there is what we call timely disbursement of funds to counties.
Kumbalani, if you'd like to have a follow-up meeting with any of us, let us know. We can maybe share some of the other learnings if you're thinking of introducing a similar program. We have a question here that I'm not sure who to direct it to. It's from Martha Davis, who is on our expert committee actually, and I think possibly the best person to answer would be Sine, but I don't know whether it's in your department. She says, are local governments you're working with preparing voluntary local reviews that address SDG6, and why or why not? And how could the VLR process be made more attractive and useful in the water sphere? Maybe out of your area of expertise, I'm not sure. It's the voluntary.
Voluntary national review, but not really.
No.
Yeah.
Maybe Patrick knows in Kenya. Are you working on voluntary local reviews through the National Commission?
Pardon, I didn't get that question.
The voluntary local review system, are you involved in that in Kenya at all, and how it relates to SDG6?
I didn't get the question.
I think it's possibly a little bit outside of the topic for today. I wonder if I can go back to Mufle if he's there, because we tried earlier to connect. Are you still in the room, Mufle? Would you like to ask your question? Otherwise, perhaps I can ask it for you. His question was, how can the results be used as a tool to promote good water governance at national and transboundary levels through engaging the UN? Would anyone like to answer that question? Mufle is based in the Middle East, so transboundary governance is a big issue in that region. Rhea, do you have any thoughts on that?
Okay. Actually, I was thinking while you were asking the question, because I know Mufle and I know the Middle East. How the results? Well, I mean, at national level, I think when we have results for many countries, there can be sort of lessons learned and see what is working, what is not working, what methodology is working, what is not working. But as was said by all the speakers, it has to be country tailored or county tailored in the case of big countries like Kenya. So it can offer, let's say, a sort of framework, but then it has to really be tailored to the specific case. So from this side, it can be useful. But then on the transboundary level, at the end, the transboundary level depends on the national level, because whatever decision is taken by, let's say, a joint commission managing a joint water body, the joint at the end, the decisions are adopted, have to be implemented at the national level. So we revert back to the issue of what happens at the national level.
I think it's a little bit outside of
it can, yes,
what we've been talking about today, isn't it? Mm-hmm. And I suppose if we're to kind of wrap up a little bit here, because we're close to the end. I've really appreciated having everyone's presentation today and the discussion. It is a new area, and I'm not sure that everybody's really got their head around it yet. Human rights-based indicators are not the same as performance indicators. They are something that can be used to help understand how services are provided, and making sure that they're inclusive to vulnerable and marginalized people in particular. And it is a disaggregated approach. It's much more in detail than the JMP statistics or the national level. It has to be done at a local level, and we've really been working hard with the Kenyan Commission to see if we can find a system that would work not just at a county level, but also at a national level. And that's something that we want to try and do next. So I hope it's been interesting for everybody today. It's really a kind of we're kind of at the beginning of this process of trying to use human rights indicators at the programmatic level, as described by Natalia. It's a little bit more obvious what you need to do, because you have a specific program with a goal and you know who your customers are. At the national level or a county level, it's much more complicated, and you really need a local organization partner like the National Commission in Kenya that has not only the ability, but the expertise, the contacts, the mission to also work with local communities, so that they can actually help to integrate it into local policy. So I thank you all of you very much for your presentations. I'd just like to hand back to Rhea, and maybe Rhea can
well, I would like to thank you all, and thank you the participants for their interesting questions. I mean, as you said, Amanda, it's a new area, and so we are progressing and learning, and it's very important to know the importance of having, like was said by all of you, country-driven indicators. Of course, we can have a guidance from international norms, international standards, international principles, but then it has to be country-driven, and this is so it's important to engage with the local people working on the ground, like in the National Commission in Kenya, and I see that the fund where Natalia is working is doing this work. And it reminds us that the human right to water, it was said, is important for the validation of other human rights. So it's a complete right, and englobing much more than what is written on the paper. Intangible things that, as was reminded, having a nice bathroom, children happy to go to school and enjoying a shower. Thank you for all the participants who have joined us, and thank you for the speakers for their very enlightening talks and for the debate. And I hope we will meet again in the next webinar. Okay, bye-bye.